Hello everyone, welcome back to Med-Surg Mentor. Today let's discuss a topic from respiratory system which can quickly cause serious life-threatening complications. And that respiratory condition is pulmonary embolism. Okay, let's get started. Definition of pulmonary embolism. It is the blockage of an artery in the lungs by a substance that has moved from elsewhere in the body to the bloodstream. Now let's move on to the etiology of pulmonary embolism. It is caused by blockage in the pulmonary artery, and these blockages can be caused by blood clots, fat from marrow of a broken bone, part of a tumor, air bubbles, and amniotic fluid. Next is risk factors of pulmonary embolism, and they are disorders that affect clotting, deep vein thrombosis, surgery, stroke, prolonged immobility, heart diseases, obesity, cancer, smoking, pregnancy, older age, traumatic fractures, and estrogen-based medicines. Pathophysiology of pulmonary embolism. Due to etiological factors, thrombi detach from the site of origin and will embolize the pulmonary artery. It results in pulmonary artery occlusion, leading to impaired gas exchange and poor circulation. These changes leads to increased pulmonary vascular resistance and ventilation perfusion mismatch. Gradually, humoral mediators like serotonin and thromboxane are released from activated platelets, which trigger vasoconstriction in the unaffected areas of the lungs. Ultimately, it results in increased right ventricular pressure and right ventricular failure. Clinical features of pulmonary embolism, and they are sudden shortness of breath, unexplained chest pain, cough, palpitation, dizziness, anxiety, excessive sweating, fever, low blood pressure, leg pain or swelling, and clammy or discolored skin. Commonly used diagnostic measures to rule out pulmonary embolism are D-dimer, arterial blood gas analysis, chest X-ray, ultrasound, CT pulmonary angiography, ventilation perfusion scan, pulmonary angiogram, and MRI. Major complications of pulmonary embolism are cardiac arrest, obstructive shock, pulmonary infarction, arrhythmias, cor pulmonale, hypoxemia, heparin-induced thrombocytopenia, pleural effusion, and pulmonary hypertension. Now let's move on to the medical management of pulmonary embolism. There are mainly two kinds of drugs which are used in pulmonary embolism, and they are anticoagulants and thrombolytics. Anticoagulants are also called blood thinners. These drugs prevent existing clots from enlarging and new clots from forming while the body works for clot breakup. Commonly used anticoagulants are warfarin and heparin. Second category of drugs are clot dissolvers or thrombolytics. It is used in patients with acute pulmonary embolism to rapidly dissolve the emboli and to improve the cardiorespiratory functions. Best examples are tissue plasminogen activators, streptokinase, and urokinase. Surgical managements of pulmonary embolism. There are mainly two procedures, and they are percutaneous thrombectomy, and vena cava filter. Let's see each one in brief. A percutaneous thrombectomy is the insertion of a catheter to the site of embolism using X-ray guidance. Once the catheter is in place, it is used to break up the embolism and to extract it by suction. It is often used in conjunction with thrombolytic therapy. Second procedure is vena cava filter. It is commonly used in patients who have blood clots in the vein but cannot take anticoagulants. It is a small wiry device which will be placed in inferior vena cava. This filter catches blood clots and stops them from moving up to the heart and lungs. Now let's see some of the preventive measures of pulmonary embolism. And they are: exercise regularly, avoid crossing legs, maintain ideal body weight, do not smoke, wear compression stockings, elevate leg during night, ensure early ambulation after surgeries, take a break from continuous sitting, drink plenty of fluids, and do not wear tight-fitting clothes. Nursing diagnosis for patient with pulmonary embolism. And common nursing diagnoses are: impaired gas exchange related to decreased lung perfusion, ineffective breathing pattern related to ventilation perfusion mismatch, deficient knowledge regarding uncertain outcome, risk for bleeding related to anticoagulant or thrombolytic therapy, acute pain related to inflammatory process, activity intolerance related to chest discomfort, and fear and anxiety regarding unknown outcome. Now let's move on to the nursing care of patient with pulmonary embolism. And they are: assess skin color, nail beds, and mucous membrane for color changes, monitor vital signs, oxygen saturation, and arterial blood gas values, auscultate lung sounds, administer oxygen as indicated, position the client in upright sitting position to optimize lung perfusion, administer anticoagulant therapy as prescribed, watch for bleeding, encourage deep breathing and coughing exercises, monitor platelet counts, PTINR, activated partial thromboplastin time, hemoglobin, and hematocrit, and administer thrombolytic therapy as prescribed. So far, we have seen regarding pulmonary embolism. Pulmonary embolism happens when a blood clot or any other kind of emboli lodges in the pulmonary artery in the lungs. It affects the normal blood flow. And the warning signs of pulmonary embolism are shortness of breath, chest pain, cough, sweating, and dizziness. We have also reviewed definition, etiology, risk factors, pathophysiology, clinical features, diagnosis, management, complications, nursing diagnosis, and nursing care. Thank you so much for watching, and if you find this video helpful, please like, share, and subscribe to my channel. Thank you.